Good afternoon, everybody, and welcome to today's virtual lunch meeting. I'm Alec O'Dare. I'm the Managing Director for the Journal of Community Nursing and Wound Care People. This evening's session is in partnership with, or this afternoon's session, I should say, is in partnership with Hartmann. So I'd like to extend a very warm welcome to the team from Hartmann and also a thank you for those for supporting it. The session is called Time to Discover Effective Exudate Management with Zetuvit Plus Silicone Border. And our speakers today are Alison McGrath, who's the Clinical Partnership Manager, and Jodie Jackson, who's the Healthcare Partnership Manager, both from Hartmann, and both joining me right now. So Alison, Jodie, how are you? Are you there?
We're here. Welcome.
Thank you. Yeah.
Thank you.
Brilliant. Okay, so without further ado, I'm not going to spend too much time on this because most of you would have joined us for these events already. Today's session will count towards your CPD. Links to certificates will be available at the end. You'll see that we're presenting from our home, so if there's any technical issues, do please bear with us. And ask as many questions as you possibly can through the chat function, because we'll be coming back for the live Q&A after the short presentation. That's it for me. Ladies, good luck. I'm going to hand over to you now and pop myself on silent, and I'll come back for the Q&A in just a bit. Thank you.
Thank you. Okay. So welcome everybody to today's virtual lunch meeting. It's great to be here. And as mentioned, I'm Jodie from Hartmann, and I'm also joined by my colleague Alison as well. Today's session, we're going to be exploring Zetuvit Plus Silicone Border and effective exudate management. We will discuss exudate related complications, how to identify them and how to prevent, most importantly, and introduce you to our latest innovation, Zetuvit Plus Silicone Border. And then after which we'll share with you some clinical outcomes that we've already seen with this new product. So before we go any further, Alison, anything else to add to that?
No, that's great. Thank you, Jodie. So yeah, it's a short session, but really just going to recap, why we really need to manage exudate effectively, how it affects the patient, and how this new dressing will, reach those outcomes. So look forward to sharing it with you.
Brilliant. So Alison, I think we're now going to look a little bit more detail into exudate. So I'll pass over to you.
Thank you. So to start off with, we're going to talk about what may cause excessive exudate production. And some wound types are more prone to higher levels of exudate. For example, venous leg ulcers, dehisced surgical wounds or burns. In normal wound healing, the amount of exudate usually diminishes as healing progresses. The constant inflammatory status of a chronic or non-healing wound results in long periods of high levels of exudate. Larger, deeper wounds may produce higher levels of exudate, as can wounds in dependent parts of the body, such as the lower leg. Conditions such as cardiac failure, endocrine disease, infection, malnutrition, can all lead to increased levels of exudate, as will local factors such as having a foreign body in the wound, a wound infection, or edema secondary to venous or lymphatic disease. So the effects of excessive or unmanaged exudate is significant. Leakage or soiling can be particularly distressing and burdensome because of the increased need for washing clothing and bed linen. There may also be an increase of odor and therefore embarrassment for the patient. The saturation of dressings may provide a route by which microorganisms can enter the wound and therefore increase risk of wound infection. Frequent dressing changes can be taxing and distressing to the patient, particularly if the procedure is painful. Peri-wound skin damage, which can include maceration and excoriation of the skin surface, can be really painful for the patient and have a knock-on effect on healing. Significant protein loss puts the patient at risk of fluid or electrolyte imbalance. And also large wet wounds can lose more than the recommended intake of protein for many adults. Excessive exudate can have a serious psychosocial impact on patients and reduce their quality of life. So work, social and home lives can be disrupted due to the dressing changes, the embarrassment, or the fear associated with odor or leakage. Dressings, therefore, represent the mainstay of exudate management, and the ideal dressing needs to maintain a moist wound environment at the wound bed, retain the exudate within the dressing, so protecting the surrounding skin, be comfortable and conformable, easy to apply and atraumatic on removal, absorbs the odor, and prevents leakage and strike through. So this document here that you can see on the slide was published in 2019 by the World Union of Wound Healing Society, and it recommends the use of superabsorbent polymer dressings. After considering the many effects exudate can have on a wound, the skin, and the quality of life, it is apparent the importance of using the right dressing for effective exudate management. This clinical paper included a retrospective audit of clinical data, such as wound treatment regime of patients requiring treatment for the management of moderately to highly exuding wounds. It investigated the costs and consequences of poor exudate management and found that 65% of the patients failed to meet the clinical objective of exudate management. Patients developed subsequent skin breakdown, such as maceration and excoriation. So using a more absorbent dressing, such as a superabsorbent polymer, demonstrated reduced costs when compared to the audit costs. Jodie's now going to start to introduce you to this Zetuvit Plus Silicone Border range of dressings.
Thanks, Alison, and thanks for sharing that information. I think it's always imperative that at the heart of everything that we do, we consider the patient and how those complications when exudate isn't managed can make a massive impact to their quality of life. And that comes into one of the reasons as to why we developed Zetuvit Plus Silicone Border. We developed this product based on feedback from clinicians globally who said that this was something that was missing from their toolkit. And this is evident by the retrospective study you referenced, where at times, the majority, 2 out of 3 times, patients with moderate to highly exuding wounds weren't always having the most optimum dressing. And this is because the dressing that they need hasn't always been available. So that's what led us here today. So Zetuvit Plus Silicone Border is a super absorbent dressing with the core part made up of Zetuvit Plus with those super absorbent polymers that I'm sure and hope that many of you have used and trust. We've incorporated a silicone contact layer allowing for atraumatic dressing changes and a silicone adhesive border, which is beautifully gentle and gives great adhesion, giving you a really strong, versatile dressing. We're now going to show you a short video which will just explain the composition of the product in more detail, and then we'll come back to you with a little bit more information. Thank you.
Zetuvit Plus Silicone Border. Mode of action. Appropriate exudate management plays a key role in the healing of wounds with moderate to high exudate levels. Zetuvit Plus Silicone Border is a silicone SAP dressing with border that offers very high absorption and retention capacity while maintaining an optimal microclimate. Zetuvit Plus Silicone Border consists of 5 layers. Excessive fluid is absorbed through the silicone wound contact layer. The hydrophilic non-woven layer ensures the exudate is quickly taken up. A special diffusion layer spreads the moisture horizontally for improved fluid distribution. The core of Zetuvit Plus Silicone Border consists of a unique combination of cellulose and SAP. It locks absorbed fluid by transforming it into a gel. Inhibitors of wound healing that are contained in the absorbed fluid, like matrix metalloproteinases and bacteria, are bound to the superabsorbent particles inside the core. Zetuvit Plus Silicone Border, high absorption and retention capacity, and an optimal microclimate. For patients, the structure of the core offers comfortable padding and protection against mechanical shocks. The backing film is breathable and at the same time bacteria-proof, virus-proof, and waterproof. The silicone contact layer allows atraumatic dressing changes, as well as repositioning of loosened edges. For optimal moisture management, make Zetuvit Plus Silicone Border your preferred choice.
So I hope you found that video helpful to understand the product in a bit more detail. And we're now going to explore some of the product benefits that you will see with Zetuvit Plus Silicone Border. So for us, Zetuvit Plus Silicone Border is effective, versatile, and patient-friendly. Effective in its ability to absorb, retain, and sequester exudate and bacteria, preventing those exudate-related complications that you can see, such as leakage and maceration. Versatile in its ability to manage changing levels of exudate, giving you confidence in the dressing choice that you are making. And this is a suitable dressing for a wide variety of wounds, so it's a great addition to your toolkit there. This product is specifically really patient-friendly, and as we move forward into a world of looking more into shared care approaches with our patients, having a dressing which is easy to apply and remove, giving good comfort and confidence to that patient to be on board with their regime. And due to the backing, this product reduces the risk of leakage and again gives that confidence to the patient that they won't suffer any leakage onto bedding and clothing, allowing them where possible to have a more active life. And the waterproof ability of this dressing allows the patient to feel clean and to feel comfortable and to want to socialise more. We're now going to look a little bit more into the superabsorbent polymers and why this dressing is potentially different to what you've seen before. Silicone dressings aren't new, but silicone bordered dressings with superabsorbent polymers to this concentration is a really exciting step forward. So Alison, if I pass over to you now just to go into a bit more detail there.
Thank you. So superabsorbent polymer dressings, also known as SAPs, these help to reduce the concentration of inflammatory cells in the wound bed, as they can bind wound exudate and lock it within their core. In this way, the unwanted components of exudate, such as bacteria, proteases, and inflammatory mediators, are trapped, which inhibit microbial growth and reduces the MMP levels, as well as avoiding potential leakage and the associated risk of infection. They therefore provide a moist wound environment conducive to wound progression and healing. We're now going to show a really short video that just reinforces some of the points I just raised there.
Inhibitors of wound healing that are contained in the absorbed fluid, like matrix metalloproteinases and bacteria, are bound to the superabsorbent particles inside the core.
Thank you. Hopefully that just brings together what I've said, and it just demonstrates the superabsorbent polymers within the dressing, how it does bind that bacteria and help that wound to progress. We're now going to look at further details within the dressing itself.
Absolutely. And I think this final piece before we move into some of the outcomes really summarises everything we've discussed so far this afternoon. And that's where Zetuvit Plus Silicone Border is true innovation for us within the market. We have those superabsorbent polymer core, and you can see that represented here with the different layers on this diagram. And the extrapolated images here show those superabsorbent polymers pre, and then as they absorb and they turn the exudate into gel and lock it away safely. And combine that with the silicone contact layer and silicone border, you really have a great dressing and a great addition for you to use. So let's move forward now into some of the outcomes that we've seen with this dressing. This paper we're going to be discussing is available, so if you're in contact with your local representative, please do reach out, or we can answer some more questions and we'll talk about that in more detail for you. We're going to look at a 52 patient study, and this was a multi-centre observational study where the primary objective was to assess Zetuvit Plus Silicone Border's ability to manage moderate to highly exuding wounds. So Alison, what were some of the results that we saw?
Yeah, so the study really did demonstrate that within 2 weeks, the wounds had reduced in size by nearly 20%. Exudate was well controlled for 94% of patients in the study, which is really, you know, we can imagine that your patients, if it's going to manage your exudate levels. Pain control was rated as good or excellent by 84% of patients, and no patients experienced an increase in pain with the dressing. It's therefore no surprise that patient comfort also rated highly by 96% of the evaluators, and an increase in wear time was identified.
Thank you. So let's take a little bit more of a look into dressing change frequency and extended wear time, and maybe think about the impact that it can make on you, your service, and the colleagues that you work with. So within this study, we looked at mean frequency of dressing change pre and during evaluation. And the pre here is represented by the blue bars on this graph, which show that there were around 14% of patients were requiring several times a day or twice a day dressing changes pre-study. And to represent the performance with Zetuvit Plus Silicone Border, this is represented here with the red bars. And as you can see here, several times a day dressing changes and twice a day significantly reduced. And there was a general shift to extension of wear time, where we were even able to achieve every 4th day dressing change frequency here. And this really demonstrates to us how effective using a superabsorbent polymer dressing when you have a moderate to highly exuding wound can really make a massive impact, one, to your time, but also to patient comfort, because this indicates that the patients were tolerating the dressings really well, they were comfortable, and they were feeling that the dressings could be left on longer, which promoted undisturbed wound healing, resulting in some of the other clinical outcomes that Alison's just outlined. So let's explore this a little bit further. And we've taken an example here by taking those same pre and during study change dressing change frequency percentages and applied them to, say, 100 wounds. So as an example, if we were to take 100 wounds with the pre-study dressing change frequency results, we would expect to see around 74.5, to be specific, dressing changes within that time period. If we looked at this with Zetuvit Plus Silicone Border and applied the same percentages as resulted within the study, we would expect to see 48 dressing changes. So that's resulting in 35% less dressing changes a week. One, from an environmental impact, from your time and from patient comfort, this really tells us that when you're looking at your pathways and when to use certain dressings, this is the optimal time to use a dressing such as Zetuvit Plus Silicone Border. Alison, before we move on to a case study, is there anything else you'd want to discuss about this from your time, particularly from a clinical perspective?
Yeah, I totally agree. When you think about those reduced dressing changes, how it impacts on clinicians as well as patients. And we all know from all the recent study, like the GUEST study, we've got a reduced number of community nurses, reduced number of practice nurses. So that increased wear time is really important for the patients, but as well as the nurses themselves, to help them with the workload. Yeah,
absolutely. So Alison, back to you now to look at a pressure ulcer case study.
Thank you. So here we've got a pressure ulcer case study, and it was this other patient. He was an elderly gentleman, and he'd been in hospital for prostate cancer and had several rounds of chemotherapy. He also had spinal cord compression, so his mobility was really poor, and he ended up with a category 3 pressure ulcer. And as you can see on that picture, there was significant damage to the peri-wound skin. Initially, his dressings were being changed twice daily, and he only had very, very short periods of time out of bed, if at all. This has a significant impact on his quality of life because it was so restricted, and he was extremely embarrassed from the odour from the wound. As a tissue viability nurse, I've had to be the bad guy and tell patients they have to be on strict bed rest, and I've seen how their faces fall where they just don't want to be confined in bed. So you really have to, finding a dressing that's going to speed up the healing, manage the exudate, is going to reduce that time that they have to be on that strict bed rest. So it's beneficial to the patient, but also to the healthcare economy. So we look now to see how that wound did progress with this. And you can see that after 2 weeks treatment, improvement was seen in the condition of the peri-wound skin. The odour started to reduce, and the patient felt willing for his family to visit, which he had not previously wanted because of the odour. After 6 weeks, the peri-wound skin had healed, and the patient was feeling well. The nurses reported the dressings were easy to apply and remove, and the odour had completely gone. So his patient's quality of life changed as he was now able to get out of bed, and he even started going to the local pub. And the nurses were able to start topical negative pressure therapy. So you can see that we've still got that little sinus wound there that we needed to put the negative pressure in to the drainage tube to help that wound finally heal. But you can see the outcome there with using the Zetuvit Plus dressing and how it really did, help that wound and also the patient.
Thank you. So I think we're going to just come to a summary now, and then we'll shortly go to some questions and answers. But thank you for listening so far. And I hope that we've introduced you to a new dressing which you would be excited to use. In summary, Zetuvit Plus Silicone Border is our latest innovation. We have extended our Zetuvit family to now include a dressing which is exciting for us, but we are convinced will help to support extended wear time, protecting your time, reducing those overall associated costs to care, and also giving back patient comfort and confidence, particularly when the exudate levels are moderate to high. Zetuvit Plus Silicone Border is available in 5 sizes, which are listed here on the bottom table. And if you're looking for a similar dressing, but you don't necessarily need a border at that time, we also have Zetuvit Plus Silicone, which is in the top table for you, sort of with the green imagery there. So before we go to questions, Alison, anything we need to mention just as we summarise?
No, I think hopefully we've managed to just reinforce the importance of effective exudate management, the right dressing for the right wound, and considering that patient's quality of life.
Absolutely. So please do reach out with any questions. We're live to answer them. And I believe on the screen there are some more details of how you can obtain more information on this product. Or alternatively, please reach out to your local Hartmann representative. Thank you, everybody.
Okay.
Jodie, Alison, that was very good, very concise, lovely videos. And I think that certainly for, certainly watching it as you were speaking, I learned a lot, and I think that the product looks great. So we've got loads of questions that have come in. So we're going to get straight on to those, if that's all right with you. And the first one is for you, Jodie, and this is, how does Zetuvit Plus Silicone Border absorb exudate?
Okay. So just to summarise, perhaps maybe on the slides that we've shown, it really is about that superabsorbent polymer core, which will absorb the exudate, lock it in, but also turn that into a gel. So it's all about the superabsorbent polymers within this dressing and how it manages exudate.
Okay, thank you for that. And Alison, you've got the next question. Can the dressing be used under compression?
Yes, there's no reason why the dressing can't be used under compression. So it really depends on that holistic wound assessment. So if you've got larger levels of exudate, you can use the dressing under compression. But I know in some areas they don't like to use an adhesive dressing under 4-layer bandaging as such. So the Zetuvit Plus Silicone Border would be more probably appropriate for compression hosiery or wraps for patients are self-caring. And you could use the silicone without the border or the Zetuvit Plus under your bandages if that's what's recommended within that trust and organisation.
Okay, brilliant, thank you. Back to you, Jodie. This is a question that we see quite a lot actually, and I think it's you can probably talk about this for hours. This is when do I switch from a foam to a superabsorbent dressing?
So that's an interesting question, and I think it also comes back to what Alison said about wound assessment and sort of how you treat your what your treatment pathways are, and assessing where are the exudate levels currently or where could they be, and then deciding what's the most effective dressing to use at that point. If you feel that the exudate levels are going to increase, or perhaps you're not sure, or they have increased, that's the ideal situation to maybe step away and step up to a superabsorbent dressing such as Zetuvit Plus Silicone Border. I would say though, from a clinical perspective, Alison, anything you think would be suitable to mention there as well?
Yeah, I agree with what you said there, because really, again, it's that holistic assessment and understanding. Are we stepping up because of signs of infection? Why we got increased levels of exudate? So it's really understanding the causes for increased exudate and when to step up to something more absorbent.
Okay. Is part of the challenge when it comes to sort of foams versus superabsorbers, the descriptions that a lot of them get. So you talk about in foams, for example, where they're described as being for moderate to heavy exudates, that's it's not really the same moderate to heavy exudate as we're talking about when we're then saying moderate to heavy exudate from a superabsorbent dressing. And I think I've had many conversations over the years where there's just that bit of confusion around, we should be looking at moderate to heavy from a wound point of view, not necessarily from a capacity of a dressing point of view. Does that make sense?
Yeah.
No, I think it does make sense, and it's and for instance, if the exudate levels do reduce, you can still have Zetuvit Plus Silicone Border on there, ready for your next dressing change, where you would then reassess the next steps. And it always comes down to what's the most optimal dressing to use on that wound at that time, and that's why wound assessment is so important. And all dressings have a place. We know that, but if those exudate levels could increase, step up to a superabsorbent polymer dressing, and allow for that within your treatment pathways.
Brilliant. Question number 4. This is for Alison from Claire. How does this dressing interact with other primary dressings when it is used as a secondary dressing?
Yeah, I mean, it definitely depends on the wound itself, whether you need to use a primary dressing. And one question that I've been asked quite a lot is when you've got a really odorous wound, like a fungating wound, and this is often think we need to use a charcoal dressing first. But whereas this dressing once it's absorbing the exudate into the dressing, it's also taking away the odour. So it's thinking about, do we need to use a primary dressing? But then if you want to use a primary dressing to bride the wound, if you've got a really sloughy necrotic wound, that's absolutely fine to put this primary dressing on, and this would be there to absorb that exudate and manage the patient's symptoms.
Okay. And I guess that if you're talking about the silicone dressing, then that is the primary dressing anyway.
Yeah.
You said it gets rid of the odor. How does it get rid of the odor? Is that just from the impact of the exudate being locked away as part of the gel? There's no actual interactive element to the dressing.
No, that's it. Once the exudate's absorbed into the core, the odor's then absorbed within this as well. Yeah.
Okay, that makes sense. Let's have a look. Question for you, Jodie. How does Zetuvit Plus Silicone Border differ from Zetuvit Plus?
Okay, so Zetuvit Plus doesn't have the silicone contact layer or the silicone adhesive border. So Zetuvit Plus is a really soft dressing, and that's a great dressing to use under full compression. But naturally, we've extended the family and added in that silicone adhesive contact layer and the silicone adhesive border.
So is it simply that the silicone border is what is just fixing the dressing to the patient rather than needing to have a secondary dressing over a standard Zetuvit Plus, whether that's a big film or a compression garment or whatever? This actually, you can just put it straight on using the silicone technology to fix it.
Absolutely, and I think that's why we've had such great results in terms, and we haven't touched upon that today. We just wanted to stick to the exudate sort of conversation. But we do get great results with shared care and patients being able to apply this dressing themselves because of that adhesive border, which you can reposition. It is really comfortable to apply. It fits in perfectly within a shared care regime as well, just for the ease of application.
Brilliant, thank you. The next question is for Alison. This is from Ketty. Do we still need to use charcoal dressings then for wounds, especially those with odors, or does this dressing help manage odor on its own? Which I think we sort of touched on, but do you want to just confirm that, Alison?
I think, charcoal dressings are quite historic, where people thought we needed something to manage odor, but as soon as those dressings get wet, they're inactive. So you're really looking at a dressing that's going to manage all the wound symptoms, so the exudate levels, the odor, everything together. So it's that holistic patient assessment, making sure you're using the right dressing for that wound that's going to manage everything together. Yeah.
Okay, brilliant. This is for you again, Alison, from Chayanuti. I think that's how you say it. I do apologize if that's not how you say it. And I think we've probably touched on this, but can it be used for a patient with leaky legs?
It can, but it's really understanding the cause of those leaky legs. So if the leaky legs is due to chronic venous insufficiency, chronic edema, it's managing the cause of the leaky legs, but to making sure that you put, if you can use compression So we talked about using the dressings under compression. So we're not just wanting to use a dressing to mop up that leakage, it's managing those holistic patient symptoms as well.
Brilliant. Well, Alison, Jodie, I think there's lots for the audience to think about there. I know that there's some links on the screen at the moment for people to be able to download some additional resources, including a website or an email address that they can register to keep up with information from Hartmann. I'd like to just say thank you to you both. I know that this is your first one of these, Jodie, and I know that you said at the start. So I'm sure you said at the start you want to do many more of them. So we'll see you for a few more. And Alison, this is your second one, so you're now officially a seasoned pro at these. So that's very good. Can I just thank all the audience for your interaction today? I'm aware that these lunch meetings, we always get lots of people who are sort of stopping in their cars and things and watching these on the phone. So thank you very, very much for joining us as always. Thank you to my team. Please follow any links for any certificates to download for your CPD files. A copy of this presentation along with the slides will be available via our website from tomorrow. We'll be back on Thursday night with a Facebook Live, so do come and join us then. And have a fantastic day. That's it. Thank you very much. Goodbye.
Thank you.